Hello, everyone, and welcome to Dementia at Home. My name is Rebecca Porter, and I'm the First Link Support for the Alzheimer Society in St. John, New Brunswick. Dementia at Home is a new video education series to provide advice and hands-on strategies to enhance your loved one's care at home. Our first video is going to be about helping a person with dementia maintain proper hand hygiene during the pandemic and other tips to help keep you and your loved ones safe. In practicing hand hygiene, you will want to consider helping the person with dementia using the following 10 tips. Tip number 1, provide clear, concise, step-by-step instructions about how to wash hands and proper cough etiquette. Tip number 2, use the language most commonly used by the person with dementia. Tip number 3, use short messages that explain simple steps they can take to perform hand hygiene. Tip number 4, use large font and graphics or pictures. Tips number 5, have accessible instructions if there are other impairments, such as braille, magnified text, or pictograms. Tip number 6, have visual signs in common areas near sinks, in the kitchen, in bathrooms, or laundry rooms. This will serve as a constant reminder for both the person with dementia and the caregiver to wash their hands frequently. Tip number 7, use a kitchen timer to maintain optimal 20-second hand washing. Tip number 8, demonstrate thorough hand washing or model hand-on-hand washing with your loved one. Tip number 9, provide cues or reminders if the person has a hard time following instructions. And tip number 10, alcohol-based hand sanitizer with at least 60% alcohol can be a quick alternative to hand washing if the person with dementia cannot get to a sink or wash his or her hands easily. Other tips include encouraging the person to cough or sneeze into a tissue or the bend of their arm, not their hand. Throw the tissue in the trash, then wash hands afterwards. Remind your loved one to avoid touching their eyes, nose, and mouth as much as possible. Pay attention to flu or pneumonia-like symptoms in yourself and others and report them to a medical professional immediately. Follow current social distancing guidelines and have one person dedicated to do the shopping and other errands. Remind any visitors, such as home support workers, to wash their hands upon entering the house and before starting any care. Clean and disinfect frequently touched objects and surfaces, such as remote controls and door handles, using a regular household cleaning spray or wipe. For more tips and support, contact your local Alzheimer Society Resource Center by calling 1-800-664-8411 or visit us online at alzheimer.ca/en/nb. Take care and be well.